We understand this is a marathon. I mean, this is not a 100-meter sprint. We are a public mental health authority. So we are primarily a state and federal funded program. 44% plus of all the cigarettes sold in the United States are sold to people with a mental illness. That's startling. 25+% of their incomes are spent on tobacco products, and many of the people we serve are poor.
They're disproportionately impacted. The high rate, it's almost more than twice the rate of the regular population. Internal documents show that tobacco industry has targeted this population.
Because tobacco use impacts so many people with mental illness, it's important to use a systems approach to make a difference.
We were approached by Jim Harrington from the American Lung Association to say, hey, I've got a possibility of a grant. Might you be interested? Kind of the eye on the prize was September 15th of this year. We implemented a tobacco-free campus policy across all of our 4 office locations.
Making the Northern Lakes campuses tobacco-free was the most obvious change, but we also worked to make sure the staff understood the issue and was comfortable talking about tobacco use. We made sure tobacco use status was recorded in people's electronic health records and that the appropriate tobacco cessation programs were available.
It's one of the first in Michigan and maybe the country too to really take on a systems change approach and a policy for tobacco for mental health boards. Tobacco-free campus policy means much different than it did even 10 years ago. It includes things like e-cigarettes. It includes all tobacco products in cars as well. As an institution, it says tobacco use is not in the best interest of the health of the people we serve. And we need a supportive environment for them to be able to quit successfully. They're expecting to be asked from a health professional, do you want to quit? We didn't initially address this with having staff ask and advise to quit. We went through a process of training them how to do that. They know how to change behavior. So we started some staff education.
We have 4 offices in 6 counties. It was so critical that we had people in each office. So having sort of change managers, change champions really helped because, one, they could have conversations with people outside of meetings.
Having the resources, the quit lines, and the training for their professional staff to do it furthers that so that when somebody's ready to make an attempt, they're in a better position, both the campus and information-wise, to be able to help that person with a successful quit attempt.
Many people we serve still smoke. We've got great signage, I think, at all of our buildings, so people know it's a tobacco-free campus. But ultimately, they've agreed to do that. They've honored those signs. As far as I know, we've had no person we serve say, I'm out of here, I'm not going to get services here anymore.
This work wouldn't be possible without the Northern Lakes Community Mental Health Board, their full commitment to this. And we are so fortunate to have that and have them be the leaders in this area.
We understand this is a marathon. I mean, this is not a 100-meter sprint. You know, when we said we were going to approach this, we knew this would be a change to our culture, and we were prepared to stay attentive to this for a long time.